Have you ever pondered about what first aid is and why it's so crucial? Well, let's dive into this vital topic together. First aid, in its simplest form, is the initial assistance given to a victim of injury or illness. Comprised mainly of simple medical techniques, it's often performed by a non-expert but trained personnel to a sick or injured person until definitive medical treatment can be accessed. Certain self-limiting illnesses or minor injuries may not require further medical care past the first aid intervention. So, why is first aid important, you might ask? It can mean the difference between life and death in a critical situation. It has the potential to save a life, to prevent a situation from worsening, or to promote recovery. It is the immediate care given to a person who has been injured or who suddenly becomes ill. Now, let's walk through some basic first aid procedures. First up, the primary survey. This is a quick way to find out how to treat any life-threatening conditions a casualty may have. It follows the acronym DRABC: Danger, Response, Airway, Breathing, and Circulation. Danger: ensure your safety first, then check the area for any potential dangers to the casualty. Response: check if the casualty is conscious. Ask them questions. If they are not responding, they're unconscious. Airway: if they're unconscious, check their airway. Tilt their head back and lift their chin to open the airway. Breathing: look, listen, and feel for normal breathing. Circulation: if they're not breathing normally, call for emergency help immediately and start chest compressions and rescue breaths. In the event of bleeding, apply pressure to the wound, elevate the injury if possible, and seek medical help. For burns, run cool water over the area for at least 10 minutes, then cover with a clean, non-fluffy material. In case of poisoning, it's crucial to find out what, when, and how much poison the person took, then get medical help. And remember, in any emergency situation, stay calm, get help, and try to reassure the casualty. To sum up, first aid is a vital skill that can save lives. It's the initial assistance given to a victim of injury or illness. The primary survey, following the acronym DRABC, helps to identify life-threatening conditions. Bleeding, burns, and poisoning all require specific first aid responses. Remember, the goal of first aid is not to solve the problem. Its purpose is to stabilize the person until medical professionals can take over. It's about doing the best you can in the moment with the knowledge and resources you have. It's about being the difference between a bad situation getting worse and a bad situation leading to a positive outcome. So consider getting trained. You never know when you might be the person on hand when an emergency occurs. It's a small investment of time that could save a life.